Hey everyone, it's Natalie Bencivenga, and welcome to Facts Over Fear. I'm back with one of my most favorite people, and of course, health expert, Dr. Natalie Gentile. She is, as everyone knows, a healthcare disruptor, a direct primary care physician. She is also the founder of Rebel Wellness and the co-founder of Direct Care Physicians of Pittsburgh. And Dr. G, we have quite an assortment of topics to get through today. I feel like every day there's a new fire, but with this administration, I feel like the fires just multiply on multiply. So I'm really glad to have you here. You guys, as always, Dr. G is a regular, so we're hoping to do this, hopefully maybe once a week or at least once every other week to continue to provide a way to solve some of the misinformation and disinformation that spreads around public health. So please share this video. So I wanted to kick things off. There's 3 topics we're going to hit today. First, there is a report coming out from The Guardian and many other places that girls as young as 13 are testing positive for pregnancy inside ICE detention centers, are being shipped away, right? So they're being sexually assaulted inside these facilities, becoming impregnated, and then they're being shipped away. Okay, this happened a few months ago, but what is new is The Guardian is reporting these girls are missing. So I want to talk a little bit about the public health implications of how we are failing our children on every single level as it pertains to ICE. Then we're going to segue into the conversation around health insurance, because what if your health insurance company didn't just deny your claim, but they became your lender? Mm-hmm. That seems a little bit like a conflict of interest. Millions could be forced to take out loans for their health insurance providers to cover medical bills if the Trump administration has their way. And then we're going to wrap things up talking about a study that just came out around children's well-being, which has plummeted in 29 states since the pandemic started in 2020. And I want to discuss this, Dr. G, in terms of how resourcing our communities is linked to children's health outcomes from birth to 18 years of age. And of course, how this factors in. I know you've been talking a little bit about the world's first trillionaire, at least on paper, Elon Musk, and what we could actually do with $1 trillion as it pertains to our public health. So we'll discuss all of that. But let's just dive right in. And if anybody has any comments, I see some people joining. Please feel free to share your questions for Dr. G. Keep it respectful as always, and I'll try to get to them. So, why were pregnant, unaccompanied migrant children from across the country transferred to a single facility in San Benito, Texas? Are they receiving appropriate medical care, especially in a state, and this is important, with one of the nation's strictest abortion bans? And these are children, right? And perhaps most troubling, where are some of these girls? And in some cases, they're infants. Now, Representative Maxine Dexter has a lot of questions. This is from The Guardian. Dexter, an Oregon congresswoman and former critical care physician, raised those questions after visiting the facility, being denied access to speak with these children. More than a month later, she has no updates and has not received any answers. So, of course, this is highlighting a broader problem, from reports of hunger strikes at ICE detention centers to, of course, allegations of inadequate medical care and restricted oversight, which we've talked about on our shows together. Concerns about transparency inside the nation's immigration detention centers continue to grow, especially when we're now hearing that children as young as 13 are becoming pregnant and are being assaulted. There's been a lot of cases around that sexual assault by these ICE detention center officials. So, Dr. G, first visceral reactions as just a human, and then let's talk about this from a public health perspective.
I mean, immediate is as a mom, I think of these, kiddos. So young women being assaulted is never okay. Hard stop. And then we start to think about maternal health. So okay, now these young women are pregnant. What are the standards for maternal health care in these settings? And then when you start to say that they're shipped away, to where? What's happening? Right. What is available for them for their care? And then we add to that, are these wanted pregnancies? Well, if they were sexually assaulted, I would assume not. So what is the availability for abortion care in a safe way? And what you're saying, Natalie, is that does not exist. So it's scary. I mean, I think it's terrifying as a physician because we already have relatively abysmal maternal health for many populations, especially our Black maternal health care. And I wouldn't imagine that it's excellent in ICE detention centers, right? We've already seen in other instances diseases running rampant in detention centers. I can't fathom that there's, evidence-based, consistent maternal health care for these young women. So, this puts everybody in danger. This puts
Yeah.
families in danger. This puts these young women and their babies in danger. And I want to know what's being done about it.
I do as well. When I was thinking about how I wanted to approach this topic, I want you to explain to people, being a physician, um, when we're talking about a 13-year-old's body, right? What are some of the specific concerns around pregnancy and birth that would happen with someone that young?
Mhm. The immediate thing I think of is actually not even so much physical as
Uh-huh.
mental.
Mm,
The mental health impacts of a pregnancy on a young teen.
mhm.
So, these young women at 13, for example, are freshly into having consistent periods, first of all. So
Yeah.
let's talk about that. Their bodies are still just adjusting to puberty. But then we bring in the mental health, concerns about pregnancy and what happens to a woman's body with the hormonal shifts. It's hard enough for women who are adults in stable income, stable relationships, or stably wanting a pregnancy to go through pregnancy, let alone a child.
Yeah.
And so I have grave, mental health concerns for these young women because of the shifts that occur in the body from a hormonal perspective. It's terrifying.
It's terrifying, and it's also just like, I'm confused as to where they are. We look at all of this and we see what's gone on with the Epstein files and the trafficking of young people and children and babies, and we see how they've covered all of that up, and then we see what's going on at these ICE facilities, and it just feels like an extension of one nightmare spilling over into another. And because there's been so little actual action with these files, it kind of makes sense to me that there's a lot of hand waving with what's going on here with these ICE facilities. And I
Mhm.
also just find it concerning, to your point, that who are these people in charge at these facilities, and why is this happening? Like, I think that's the question too, where it's like, what do you mean girls are, this is how it's been phrased, becoming pregnant as young as how are you
This isn't the
becoming
immaculate conception. I mean,
right?
I think we know how this works.
Right. And so I feel like, once again, there's this lack of accountability
Yeah.
from how we're even framing this conversation. So that's why I really wanted to bring it to the forefront of attention today. And thank you for speaking honestly and candidly about this. As we move on to our next topic, as I was thinking about what topics we were going to touch on today, Dr. Gentili, you've just been such a leader in speaking out around the insanity of our healthcare providers, around our healthcare insurance networks, and how they are in no way promoting health care in our system. And I'm always so proud to know you, because you chose to step outside that corporate system and do your own thing, which is a very scary endeavor, to go out on your own. Can you talk about, before we move into this next topic, why you decided, and can you explain to people the difference between direct primary care and the normal quote unquote corporate insurance model? Because I think that will help
Yeah.
set the stage for what we're going to talk about next.
Sure. So direct primary care is basically, think about your old school family doc. So there was a time in history where you would go down the street, know your doctor, go to knock on their door or have their phone number, and then you would pay cash for the services that you received. And that was
Hmm.
very much the relationship. What this has evolved in over time is health insurance getting involved, doctors significantly overloaded, clinics short staffed. Most PCPs have 2 to 3,000 patients assigned to them now. So it's no surprise that you can't get in for an appointment. You're not seeing the same person each time. We have diluted what primary care docs are actually capable of doing now. We go through such a significant amount of training, and then you get out into practice with a 7 to 15 minute visit. You're not
Mm.
doing all that you can at the top of your licensure. And I didn't want any part of that any longer. So I chose to go the route of a direct primary care model, which is back to that old school family doc. It's a membership based model of care. My patients pay $99 a month and have full access to me as their doc. I do not bill insurance. So I have hour-long visits with patients. They have my personal cell phone number, my email. They can get in same day, next day appointments. Over the weekend, I handled a handful of acute needs, urgent care needs for my patients, plain and simple. And because of the price point of $99 a month, and because there are, many people out there who are uninsured or underinsured, this type
Mhm.
of practice model, direct primary care, not concierge medicine, okay, direct primary
Right.
care is blossoming and exploding right now because as health insurance premiums have rise so substantially, people are completely being priced out of having health insurance.
Oh, yeah.
And they're wanting, not only has it, like, the first layer was, I just want a better relationship with a doc that I can actually talk to and access. And now in the past year or so plus, we're hitting a fever pitch of, yes, that sounds great. And also I have no access to care. So, like, this seems like the best option. So I chose to, branch out and do this model of care because it saved my ability and sustainability to practice medicine, because I don't have anybody telling me what to do, and because it is
Mm.
what I believe is the best option for a lot of my patients that I'm seeing. Is it the solution for the entirety of all issues in our healthcare system? No, and nobody's claiming for it to be, but it is one of the models and options out there right now that is.
Yeah, and guys, I can attest to this because I am one of her patients, and I do pay $99 a month, and I do text her with random questions, and I always get an answer back. The most recent being around, should I use creatine? And we had a conversation about it. So, as simple as something like that is, it's a lot easier to go to a trusted source than it is to like put it into Chat GPT, which I'm hoping all of us stop doing just as a protest. Okay, so having said all of that, the reason I wanted to lead into it with an explanation is because the nefariousness of the health insurance model is only exponentially increasing. And what if, and I said this at the top, but we had a few new people join us. What if your health insurance company didn't just deny your claim? What if it became your lender? So let's say you have an acute medical emergency. You fall down a flight of stairs, you break your ankle. Okay. You got to go to the ER. That's something outside the scope of a direct care physician, right? You got to go get your bones set, got to go get a cast on. You get the bill and it's wild. Let's say it's, I don't know, $12,000, which at this point I wouldn't even be surprised, right?
Nope.
Let's say you even have health care, health insurance, and you're still going to pay, let's say 7,500, even though, because you didn't hit your premium or whatever.
Mhm.
Now, what they're going to say to you is, oh, here's your bill and we're going to lend you the money.
Mhm.
So you can pay it. We're going to get our money.
Yep.
We're going to lend ourselves, basically, our money.
Yep.
And then we're going to give it to you as a loan. So on top of your premium, on top of all of these other things that you have to pay out of pocket for, and guess what? We're going to give it to you at a really crappy percentage. So not only are you going to be paying your medical bills till you die, until your kids are dead, because all of this continues to transfer, you're going to have like a what, 15%, 20% APR? Who knows?
Yep.
Sky's the limit, guys. And so this is a new proposal that's being considered by the Trump administration that could allow Americans to borrow money directly from their health insurance companies to cover their medical bills. Of course, the critics are saying that it doesn't solve anything. It simply changes who the patient is owing money to.
Yep.
Instead of debt to a hospital, you could just owe now debt to your insurance company, and likely, of course, with that interest I just mentioned. And this proposal comes as already millions of Americans, to your point, Dr. G, are struggling to afford even the most basic care. Many Affordable Care Act plans carry deductibles in the thousands of dollars, and some newer plans under consideration could leave families responsible for as much as $31,000 before coverage even starts to kick in. And this is from commondreams.org, but this is all over the place. So here's the question. When did healthcare become a financial product instead of a public necessity? And what does it say about our priorities when the solution to unaffordable healthcare isn't about making care cheaper or cutting out the middleman with these insurance companies, right? But instead, it's about offering people a loan. Can I have
Mhm.
your thoughts on this?
I was shocked when I saw
Mm.
this morning and read about it. I was like, This just can't, it just keeps getting worse." It is so fascinating to me that there's been this message, like if you look at Maha, for example, and you hear
Hmm.
all the messaging from Maha and people like RFK Jr. and people like Dr. Oz, doctor at this point, like that should be just revoked. The discussions around prevention, we've got to do prevention. We've got to get rid of chronic disease. We've got to get rid of all these people with their chronic problems. It's your fault, it's your fault, it's your fault. And there's never actually a discussion around, like, the solutions are already always bandages. They're always band-aids on for the current issues.
Mm.
And then this is yet another example of that, because instead of talking about the actual cost of healthcare, And the actual way that insurance companies are absolutely screwing patients every single day,
Mm.
we're just going to put a Band-Aid on top of it, and they're going to loan you money. And it's furthering putting people into debt. It's furthering putting patients in a position where they are beholden to now not only hospital systems, but insurance companies. And I truly do not see a way how this is like the way out. I
No.
don't see how this is a solution.
No. You know what this reminds me of? This is the classic end stage capitalism of we're in the extraction stage, right? Where it's like anywhere we can bleed the rock dry,
Mhm.
we're going to do it. And it's the classic, we're creating a problem and then we're going to sell you the solution.
Yes.
But the solution, to your
Yes.
point, is not a real solution. It's just an exacerbation of an issue. I mean, the issue is obvious, right? The issue is we need some form of universal healthcare, in particular for catastrophic care, because I am of the full, I've been in support of, universal healthcare since I was in high school, and I realized what was happening and I started reading. And to me, what I love about direct primary care is I think these things can all work together because,
Mhm.
what we really need is not, I'm not worried about my $99 a month payment to my doctor that I have complete and full access to. What I'm worried about is, God forbid, someone in my family gets really sick and
Yep.
we lose our home. Like,
Yes.
that's the truth, right? And I think, this idea that they pushed everybody off of here in Pennsylvania, Penny,
Mhm.
160,000 and counting are no longer, utilizing the Affordable Care Act marketplace here. And the fact that I'm sure you're seeing your patients coming to you in almost desperation for things that you're like, this needs a hospital care. This needs something. And then what do you do with that? It is wild to me that they think that this is the response to that. But I think that just shows you how out of touch these systems are. I mean, you work still with you still have to deal with insurance sometimes.
Yes.
When you're in those spaces with those systems, what's going through your mind?
It's sad because I have no trust in them. So, like, I
Mm.
do still have to work with insurance companies when doing prior authorizations for patients, for imaging, for medications. I do still refer to fellow specialists within the insurance-based system to care for my patients. And I, at this point, have no, like, basis to go on to tell my patients, "Yes, this is gonna be covered. Yes, you are gonna be taken care of." It's a wild west.
Mm.
And it is so sad to see. I think it's really a scary point here because there's so much overlap. It's the same playbook as what when we talk about wellness grifters. You nailed it on the head, Natalie, saying they create a problem so that they can sell you the solution. And this is no different than people telling you, "Oh, you have adrenal fatigue. Hey, guess what? I have the
Mhm.
supplement for it." Like, I'm going to make up a fake thing. I'm going to have a supplement for it. I'm going to make a problem, which is health insurance and astronomical costs of healthcare and unpredictable and non-transparent costs of healthcare. And then I'm
Yeah.
going to sell you the solution, which is loans from the health insurance company. Another thing that I was seeing Dr. Oz talk about recently was transparency of healthcare costs and how the Trump administration is saying, like, we have to have transparency of healthcare costs and we're going to really nail it down on these hospital systems. And while I am a huge fan of cost transparency, one of the many reasons I went into direct primary care
Sure.
was that I think you should know what you're paying for. It does not fix the underlying issue of why, when I go to hospital A, is something this much money. But then if I go 3 miles down the road to hospital B, which is also owned by hospital A's health system,
Mhm.
is it this amount of money? And
Mm.
then I go to this other place and it's this amount of money. Yes, you can have transparency of costs, but we don't have control of the costs in the first place. That
Yeah.
is ambiguous. It makes no sense. And
No.
there's so many people out there that say, doctors are making all this money off of me with my healthcare. If you look at a hospital bill
Uh-huh.
and
This
you
I'm
see
so
where
glad
this
you're bringing
costs,
this up because I was gonna ask you about this. So
yeah,
yes, please share.
look at where the cost is going. Look
Yes.
at an itemized receipt. I can guarantee you
Mm.
wholeheartedly, it's not the doctor who's making the majority of the money
No.
for that.
No.
It's the now that person, that doctor, and that healthcare team is taking the liability for
Mm.
what's going on. But they are not the ones making the majority of the money from your healthcare service. It is the administrators, it is the hospital system with their absolutely, abstract costs that they just pulled out of their butts the other day and decided was the cost for that
Mm.
service. So there is, yes, transparency is important, but in the end, what we are being transparent about is what we should be asking questions about.
100%. I'm really glad you brought that up because I saw a video on Instagram and I saw that you had also seen it because I was going to send it to you, but then I saw that you already looked at it. And it was about this. It was basically this guy was explaining the breakdown of a bill and he was trying to make it seem as though the majority of this bill was because of the surgeon. And when you actually looked at the itemized bill, one of these physicians was like, this is misinformation. When they looked at it, the surgeon ended up with a very small percentage of the actual cost of the bill. And once again, I want to preface this by saying doctors, surgeons, healthcare, workers, right? You guys deserve to make a good living. You do a lot of literal life or death work every day. It's a high risk, high stress job. You have to train for a decade plus a lot of times to be able to do this work. I don't want anyone to think that the solution is for doctors to lose out in this equation. What you're talking about, what we're talking about is getting rid of all the fat that doesn't
Yes.
need to be there. And that's why, a single payer healthcare system and having doctors at the forefront of that system, creating that system would make a lot of sense because you guys are in the trenches doing this work. You deserve to be paid for your work. Just to clarify that. If you just joined us, I'm chatting with Dr. Natalie Gentile. We're doing our regular health news roundup. We've already talked about what's going on with ICE detention centers and young women and girls missing after becoming impregnated and sexually assaulted in those spaces, and no one can seem to locate them. And we just discussed about healthcare insurance lending you money now to pay the bills that they're giving you. So if you are coming late to the game, and I know a few of you just joined us, don't worry, I'm going to be posting this and you will be able to play it all back. I wanted to wrap up because I don't know if you heard this little piece of news. Elon Musk is a trillionaire. And I, for one, don't find that to be a good thing. We're going to talk about that here in a minute. But I want to tie that into this larger study that just came out. Because what if there is, we talk about children and their well-being, but this actually, what's going to help our kids? It's really not a mystery. Okay. So there's this new national report that found that children's well-being has declined in 29 states. That's over half the country since the start of the pandemic in 2020. Now, more than 22 million children, our children, are living in households burdened by housing costs, and researchers are finding a very clear pattern. When communities invest in children, children do better. When they don't, the consequences are showing up not only in education and economic security, but in their actual health. Now, the findings are challenging one of the most common narratives in American politics, that struggling families just simply need to work harder. But researchers are saying that the data points are pointing to something else, that public investment and public health initiatives matter. Access to healthcare matters, which just ties in directly with what we were talking about. Stable housing matters, strong schools matter, and public schools and communities with those supports, shocking everyone, have better outcomes for their children. So when we're looking at this, Dr. G, in a moment where economists are debating around this idea of what $1 trillion means and should any one person have that kind of access to money, why are millions of our children growing up without the resources to thrive? So can you talk a little bit about what you see in your own practice as it pertains to children and what they need to be set up for success from a health perspective?
Children are at the I was thinking about this the other day in our own household, okay? And I'm uh, demanding stuff from my kids. You do this, you do that. You eat this at this time. Kids are living in a setting where all that they do is dictated by their family or the community that takes care of them, right? Because
Yeah.
they are being raised. They're being raised up and taken care of. And if we are not taking care of the families that are raising these children, that's a
Hmm.
problem. So step
Exactly.
number one here, we talked about. I talked recently on Instagram about cuts to WIC fundings.
Hmm.
Like if we're not having access for families, pregnant women, families that are raising kiddos to healthful and nutrient dense foods, that's a problem.
Hmm.
If we've got households that have no access to, clean drinking water. They're in food deserts. That's a problem. That's going to impact kids. If we have families where the answer is for you to work harder, so there are families that the only way they can live is to work 2 to 3 jobs. So then the kids are either left home alone or they are left somewhere not really attended to and they're on a
Mm-hmm.
screen the entire time. That's a problem for children's mental health. Like,
Yeah.
none of this is rocket science. If we have
Mm-mm.
kids that don't have involved parents, right? Or parent or community or people around them who are going to keep them safe and take care of them, they're not going to develop well. If we have kids who are afraid to go to school
Yeah.
for their own safety, for bullying,
Mm-hmm.
that's going to be an issue. So
Yeah. For gun
people
safety.
forgot exactly. So
Mm-hmm.
so if this is not just you need a two-parent household and it
Mm-hmm.
needs to be, this whole narrative around this exactly is how a family should look. Families can be community, they can be extensions of parents, but somebody needs to be rallying around children, and those somebodies need access to healthful foods, safety, right?
Mm-hmm.
Clean air, clean water. These are basics. And this all impacts children's mental health. And when children's mental health is impacted, their physical health is impacted. And then, if all you care about in this administration, in any administration, if all you care about is a bottom line and dollars,
Mm-hmm.
then do not forget the impact of chronic disease down the line, which begins in childhood, which begins in adolescence. And if we are not trying to intervene on that health at a young age, you are going to have healthcare costs down the line. If that's all you cared about,
Period.
that
And
alone should be convincing enough.
I agree, and I couldn't. And another thing too, going back to a strong public education. We know that education is linked to better health outcomes as well, right? And anti-poverty initiatives always involve resourcing our community schools and our community spaces. Arlene Mach added to this saying, yes, people other than families need help too. And I agree, Arlene. I think what we're seeing is the breakdown of our communities, right? Which impacts our families, our neighbors, our friends, everyone that exists in these spaces together. Because to Dr. G's point, it's not just the nuclear family that's suffering, and it's not just the nuclear family, quote unquote, that impacts our children. It's all of us in our surrounding communities. That's why I try to always say, these are all our kids, right? Like whether we're talking about national issue, local issues, international, these children are all of our responsibility. So I think we need to start acting like it. And how we could, what I think is interesting here, if we're looking at how we could impact our children, it does come down to dollars and cents. Guys, here's a few things around what $1 trillion could do if Elon Musk decided, to wake up this morning and be like, I should start doing things with this money. $1 trillion, and I want your thoughts on this, Dr. G, could fully fund child rearing costs for over 4 million American children from birth through age 18. Now, if we distributed that on a global scale, this amount is enough to pay for 10 years of early childhood education around the globe or eradicate extreme poverty for millions of families worldwide. It's also enough to cover the average cost of childbirth for 32 million American families or provide basic necessities and healthcare for millions of youth. I think it's hard to sometimes understand $1 trillion because it's hard to understand $1 billion. But when we're looking at our future as our society, when you see these numbers, what do you want people to understand about the impact it makes to taking care of our future generations today?
Yeah. Well, I think a lot about like who's going to take care of us. For example, like if we
Yes.
look at the millennials, just
Thank you.
that age group, okay, who's
Yeah.
going to take care of us? Well, when there has been such a uh, denouncement maybe of
Hmm.
education as a whole, right? There is this overall understand or vibe from this administration of like experts shouldn't exist. We should not
Hmm.
trust anybody except for the people who are the talking heads.
Right.
That is and these are the only few things that kids should be learning about. When we start to do that and we start to impact children's education, mind you, those children are going to grow up to be adults. And those adults, what are they going to be able to do with
Right.
that limited type of education and access to education and worldview?
Yeah.
And
Yeah.
how are they going to be able to take care of our next generation? So, like, again, if you think about this in the most selfish way, how am I going to be taken care of? This is a problem.
Yeah.
Okay. So if we think that's a problem, and then if we think more globally, like child care, like you mentioned that stat, Natalie, child care impacts our workforce, impacts our workforce. So for families to be able to work and they have kids, those kids need to be taken care of in a safe setting that's going to help them thrive as well. So any angle you look at this, whether it's the
Mm.
most selfish or selfless, more most global or individual scale, the health of children is going to have consequences down the line. And it is, in my opinion, not even a partisan issue.
Mm-mm.
Children's health is something we should all be able to relate to
That's
and
right.
want to improve. And that comes from public health measures, whether it's debunking misinformation about vaccines, whether it's, improving access to healthcare for kiddos and their family members, whether it's improving childcare, access, all of this is going to impact all of us.
Yeah, period. And it would be nice if we started investing in our future here at home instead of using this money to, continue to perpetuate wars and bombing, in particular, children
Yes.
overseas and our medical professionals as well who are in the
Yeah.
crossfires. Dr. G, thank you so much as always for being a part of Facts Over Fear. If people want to follow you and learn more about your work, and you guys, beyond following both of us here on Substack or subscribing, that would be great. Make sure you check out her Instagram as well. But can you let people know where they can find you?
Yeah, I'm very active at Natalie Gentile MD on YouTube, Instagram, TikTok, Substack. And I appreciate your support. And thank you for having me, Natalie, as always.
Absolutely. And thanks to everybody that left comments and thoughts. And just as, like I said at the top of the show, I will be posting this later. So if you came a little late, don't worry, you can check it all out and give us your opinions then. Thanks, Billy. We appreciate you
Yes,
tuning
thank
in.
you.
And always, until next time, everyone, please take care of yourselves and each other. Bye, everybody.